Hoarding affects more people than we know. Hoarding is the inability to get rid of anything, obsessive buying, and having a large number of items spread across the house. First, here's the facts. 50% of all hoarders come from a hoarding household, and this makes sense since genetic factors make up 50% of all hoarders. Up to 5% of the world population are hoarders, and only 15% of these people know that their behaviors are rational. Hoarders are 3 times more likely to be obese or overweight, and hoarding disorder and OCD are directly related to each other. Hoarding is seen in at least 1 in every 50 people, but can be seen up to 1 in every 20 people. Next, I'll talk about the items being hoarded. 40% of object hoarders also hoard animals. And while this sounds cute, 45% of their homes are covered in feces and urine, and 78% of their homes are covered in trash. 250,000 animals are reported every year for being victims of hoarders, but however, many cases go unreported. Now the behaviors. Some behaviors include depression and anxiety, or indecisiveness and vulnerability. Lastly, how to cope with hoarding. Therapy. Only 70% of hoarders respond positive to therapy, and since some have to throw away all their belongings, they backtrack and refuse any more therapy. Medication. Only 1/3 of hoarders who are on medication respond to it, but since doctors do not yet fully understand hoarding, they cannot make a cure for it. Hoarding affects people's family and their whole lives, and people who deal with their hoarding, no matter how they deal with it, lead happier and healthier lives.